Hi, I'm Meredith. Hi, you heard me up there too. I am the education specialist at Boston Children's on the NF team. And you're not going to hear anything medical from me today. So you have a little break from the medicine stuff. We do have a lot of children with social challenges in school, as you're probably aware. And that's what I'll be talking about today, how to access and who to access when you're at school. So the first thing we'll talk about is what can schools do? I think there's a lot of pressure put onto schools nowadays. It's not just academics anymore, even though that is what the main focus of school always is. But we know, certainly from a lot of studies, that if a child doesn't feel safe or healthy emotionally, they have trouble accessing the curriculum. So schools have really ramped up how they are able to help kids through things like that. So we have learned that schools are better at being able to support them. There's still a long way to go. Money's always the main factor of whether they can be supported or not. And so we go with that. And I think it has kind of come to the attention of people that schools should provide therapy in the traditional sense, and they just don't. It's not something they do. It's not something they're trained for. We do, however, encourage if your child needs therapy to definitely get it outside of school and then coordinate with school to talk about, what's worked well, what's working, not working. It's very good to have the coordination between school and home that way. And your child, whether or not they're on an individual education program or a 504 plan or just in general education, they can access different accommodations for the kids that are not on any of those plans or just in general education. They certainly can access what they call best practices, which maybe your child has trouble focusing or is interacting negatively with another child. They can be separated, obviously, and somebody sits up to the front. If they need a break in school to go maybe to the nurse's office, take a break, all those things are called best practices, so anybody can access those. And then if your child is on a 504 plan or an IEP, those would be written into the plan. So I'm just going to go through a few of the key point people at school. I think some people don't understand. I get a lot of calls. Who can I talk to? Who should I address this particular social problem to? So if you know who the people are in the school building, super helpful. And most of them will overlap some, but they all have pretty specific jobs. Every school/school system, because sometimes the school psychologist is shared, has a school psychologist. They go way back. This is approaching I can't even believe it, my 40th year in education. So I've seen a lot come and go, and school psychologists are ones that have always been there. And their main jobs now, they used to have a very different role, but their main job now is to do the cognitive testing for children that are potentially going to be on an IEP or an individualized education program or on a 504 plan. So they do the cognitive testing and then they report on it at the team meeting. So that's their pretty main function now. They also are able to assess behavioral challenges at school. They're very good at doing that. They help with interventions. So some schools have what they call a behavior analyst. They will work with the school psychologist to come up with the best plan for the child to help with behaviors or social challenges that a child may have. They do a lot of the social skills teaching, and this is from kindergarten all the way through high school. It looks different in the elementary level than it would the middle school level than it would at the high school, but they're the ones that would actually do that. Whole group, small group, one-on-one, not quite as frequently because they have a very big caseload, but they're very good, skilled at facilitating how to best help with social skills at school. They also are very good at peer mediation. Oftentimes, particularly middle school to high school, kids kind of can have challenges with other peers, and they help with that and how to mediate to best work out whatever the problems might be. They are always on the school crisis teams, which are super helpful. And I don't know why that moved. This always happens with me. Okay. That's always very helpful. And they always attend the team meetings too. Even if they haven't done the school testing, they will often be somebody to answer questions. So they're at the 504 meetings, IEP meetings, and they would be someone to reach out to if your child is being bullied, or if you feel like your child needs some social skills intervention, or as a point person. We'll talk a little bit more about finding a point person at school. Super important for the parent and also for the child. School social worker, if your school has one, you're lucky. They're very, very helpful. They're fairly new to school systems, I'll say within the past decade or so. Not every school system has them. They're super helpful. Where the school psychologist focuses on what happens at school and tries to help within the school setting, the school social worker often takes on case management, and they will work with outside agencies as well within the community, with the family, and then within the school. Really, really great resource to have. They address the different, barriers to education, poverty, truancy. Truancy is something we've seen a much higher incidence of within the past couple of years, really since COVID. Abuse, neglect, things like that, or if there's housing challenges, mental health challenges, food insecurity, they can absolutely help families navigate the social assistance outside of the school system. So they're super helpful. They're typically trained in clinical social work, and they can also have a background being licensed as a social worker as well. And they help children with mental health issues, but they can't do traditional therapy. It just doesn't happen at school for any of these roles, but they certainly can help support that. They will also connect with outside therapists to help coordinate, and that's very helpful within the schools as well. They are on the crisis response teams too. At the elementary level, they can do home visits. It's up to the family if they want them to do that, but they can do it. They don't do it so much at the middle school and high school level. And they also help to create family support plans so the child can best access what they need at school. Their focus is not only in school, it's more in the community and working with the community and the school and the family. So they're a super helpful resource. An adjustment counselor, so they kind of take a role similar to what the school psychologist does, but they don't do the testing. So they do some of the same things. So there's overlap for these three different people that I'm speaking about. And so they help with behavioral adjustments at school, students' emotions, whatever's happening that way. They work always very closely with the teachers, as do the other two people as well. But working closely with the teachers is super helpful for the adjustment counselor so that they can kind of maybe take a kid out of a classroom if things are happening, or, contact the family should that happen as well. They have a background in counseling, psychology. They help with anxiety, peer conflicts, which is similar overlap to the other two, self-esteem issues, school refusal, where a child may not be coming to school for any number of reasons. They help work through those issues. And they definitely are school-based, not really community-based. And they do participate in the 504 in the IEP plans. So it would be unusual to find all three in one school just because of the financial resources or lack thereof. So there's always a school psychologist, and you might have an adjustment counselor or a school social worker. It's rare that you would have all three. And then guidance counselors, they used to do more of the counseling for kids who have social challenges than they do now. We don't really see them very much in the elementary school. It's not that they're not there, just not nearly as present as they used to be. Definitely they're there for the middle school and for the high school levels. They do more of the career planning, If a child's going on to college, they help with the college applications, meeting graduation requirements, things like that. They do some, not so much social, a little bit of the social. It just depends really on the particular guidance counselor and what their level of experience is and comfort in helping kids that way. They certainly can do it. They would rather the school psychologist take care of it, or the social worker, or the adjustment counselor. But they do help with time management skills, things that you would need beyond college, beyond high school, study skills, things like that. They do talk a lot with parents. Parents often call them when things aren't going well, maybe with a teacher. Something's happening in a classroom and they don't want to speak to the teacher about the problem. They'll call the guidance counselor. It's the correct thing to do because they can be the liaison between the parent and the teacher and kind of get things helped that way. They also run the career awareness programs, college fairs. They do track all the student progress. Sometimes in high school, kids have challenges showing the grades to parents, or parents aren't accessing grades on the portal. They're the ones that can help you do all of that and make sure your child is ready to graduate when it's time. And then the school nurse. This I feel like is a really underutilized resource at school. They're super helpful. Their main job, so to speak, obviously, is the health of kids that are at school. If something happens, they provide acute and emergency care, but they're also able to assess behavioral health concerns. They work very closely with the people I just spoke about, all of them, and they work in tandem with them, but kind of in the background. They're really an excellent resource. They also coordinate care between the family and the healthcare providers, which is super helpful. So maybe your child has ADHD medicine and the dosage has just been changed, and the teacher will go to the school nurse and say, you know what, it's not working, it's working great, whatever they may say. And they will call me and or one of the providers and let them know. So there's a really good connection. We didn't used to have such a tight connection before, but we're finding them to be really helpful with our whole team to help manage behavioral issues, social issues, medical issues, all of that. I think they're just a very helpful resource. And they're also very helpful to provide information about your child and how they're doing, just in the general background of things, not necessarily with medications. But, some kids, we call them frequent flyers to the nurse. If they're having trouble in a, math class, and it's always math, that they're not feeling well, they need to go down to the nurse. The nurse will let the teacher know, or will let me know that, this class is not working for whatever the reason may be. They're just a really good point person. They also are a good place to provide a quiet space for kids. So we don't often think of them as that type of resource, but their busiest parts of the day are first thing in the morning, lunchtime, because they're administering meds to kids. And the other times of the day, of course, they're there for, if somebody falls and that type of thing, but they have quiet times as well. It's a good time if a child's having trouble managing themselves in class with another student, having trouble with the teacher, to go take a break and sit down there. They've got the nice, so to speak, beds that they can lay on, right? And just kind of calm down and then go back to class. They're such a great resource. They also create the healthcare plans for school. If your child happens to need a healthcare plan, they're the ones that create it, and they're the ones that let the staff know about it and what to do and the protocols around it. They're definitely part of the crisis intervention teams, and they do attend the 504 and IEP meetings only as needed. They're not there for every meeting. We don't need them there every single meeting, but if needed, they definitely are there. That would be a really good access point for anybody. And then, of course, teachers. Some people feel, if social challenges are happening, really that would be your first person to talk with. And the reason that is because they're the ones that see your child more than any other person. And teachers, unless it's their first month of teaching, have a historical reference of comparing your child to their experiences, and then also comparing your child to their current classroom. So they can tell pretty much right away, are things going well? Are they not going well? And why is that happening? So they've got kind of the longevity look at things. And they also are very good at being able to tell your child's social connections at school. So they see them in small groups, how they react, large groups, all of them. And this is all the way through high school. Elementary, they go out and have recess, but the teachers have to go out as well. So they're seeing who they're interacting with. And then in the middle school and high school levels, they change classes 6 or 7 times a day. And the teachers go out into the hallways. They have to monitor. And they're seeing who your child is hanging with, if your child's interacting, how they're interacting. They have a really good sense of how things are going. Even if they only see your child for 1 hour a day, which is typical for middle and high school, they know exactly what's going on. Super good contact for you if your child is having any social challenges. And it's often a student's first choice as a point person, and should be, because that's who they see all the time. They're probably most comfortable with them. And that leads me to my last point, which is a point person, period. I think every parent should have a point person at school that you're comfortable talking to. Doesn't have to be the teacher. It can be any of the providers I just told you about. That would be very appropriate. Just somebody that you can go to and you feel comfortable talking with about your child and how to get any type of social help for them. And also for your child, really important that your child have a contact person at school. Maybe your child has no social challenges right now, but maybe in a month they do. Things come up, kids get bullied. They may have a problem with one particular other student, a group of students. It may be that there's a teacher they don't care for, any number of things. So really having a point person for your child and for you, super helpful at school, just in general. And especially if your child also is changing schools from elementary to middle to high, definitely have somebody that can help with that transition when your child goes to the other school. And then just in general, to have one overall. They don't have to be checked in on every day, but just so that they know there's somebody there that cares for them and that they can go to if they're having any social challenges. And of course, if you have any, questions about should my child see a therapist, absolutely seek outside help. We always encourage that. Can be very helpful and always good to connect them back with school. So the takeaways are really there's a lot of ways to access different social points of contact for anybody at school. Good to know who is who and what their roles are. And finding a point person, I think, is just really important, both for the child and for you. And to take advantage of the available resources, they're free. You pay for it through your taxes, obviously. Some are great, just like anybody, right? So you just kind of have to work through and see who you really can connect with and who not. But they're just super helpful for outside of school resources as well as in school. And like I said, seek help outside if you need it. And that's that. Hey.